I rise in support of single-payer health care and in support of moving this bill forward today so that we can continue the process and the conversation of coming up with a really solid approach to single-payer in California so that as the federal administration persists in taking a wrecking ball to access to health care, we can move in the other direction in California and move towards greater and greater and ultimately universal access to health care. That's what we're about in California, and we have an opportunity to take a step today in that direction, understanding that we have significant work to do on this bill moving forward. It is a work in progress, but this is an important step forward. Taking a step back and looking at the big picture, I appreciate the comments of the senator from El Dorado about the economic hardships that people are facing, that people are living on the edge, that people are struggling. And there are many reasons why people are struggling, but we know that one of the most significant reasons that people struggle, that people go into bankruptcy, is medical bills. Because in this country, for far too long, instead of creating a true safety net to make sure that people have that fundamental right to health care, to be healthy as families, we have thrown people into to just defend for themselves. And the number of people in this country who have gone into bankruptcy, who have lost their homes, who have lost everything because they were the unlucky ones who didn't have insurance or didn't have good insurance, and had an accident or an injury or a serious illness, and they went bankrupt. And that is a huge issue in this country, and the Affordable Care Act has made it better, absolutely, and that's why I've been a strong supporter of it. But it is not all the way where we need to be in terms of having that safety net for universal access to health care. In terms of the government not being able to get anything right, again, with all respect to my friend from Stanislaus, the government is imperfect. I'll be the first to admit that. But when you look at the number of people in this country who have access to health care only because the government provides that access, we the people decided to provide that access, it is an extraordinary number of people. Medi-Cal and Medicaid in general needs a lot of help, and I'll tell you, when this administration proposes to cut hundreds and hundreds of billions of dollars from Medicaid, that's not going to help people get access to health care. Having robust Medicaid does help many people gain access. And the interesting thing is, when people were attacking the Affordable Care Act back when it was being proposed and in the legislative process, I remember there's a very famous, sign someone was holding that had been fomented by the opposition to the ACA. Government, get your hands off my Medicare. Remember that sign, colleagues? We all saw it. Government, get your hands off my Medicare. People didn't even realize that Medicare was a government program that people made the same arguments against in the 1960s that we're hearing against single payer today, that it's some sort of socialistic takeover of the healthcare system, it's going to destroy everything, and we know that Medicare has made sure that seniors, and particularly low-income seniors in this country, are not impoverished and living in perpetual sickness simply because they are old and poor. We can get this right, and I think we will get this right. I do want to emphasize this is a work in progress, and this is going to take time. We have this year, we even have, if we choose, and we may, into next year, to work collaboratively, the Senate and the Assembly and the governor, to come up with a great single-payer bill. There are parts of this bill that I want to see progress on. Right now, the bill focuses on fee-for-service. I think that that is a significant issue we need to address. One thing we learned when we went to Canada is although there are pros to the fee-for-service system, there are also drawbacks in terms of cost containment. And so we need to take a hard look in terms of the extent to which fee-for-service is appropriate or inappropriate. I also know that the governing board that was set up to oversee this system, I'd like to take a harder look at that. There are various parts of this bill that I believe will change and will get better. But today, we're taking a vote to move this process forward. I do not want to stop this in its tracks. I want it to move forward so we can come up with a great single-payer bill, and I urge your aye vote.